morning, everybody. So the topic of my QI project that I've been working on last year and this year involves developing a neurosurgical spine post-operative note template and Epic to help facilitate multidisciplinary care and communication. I worked on this with Donna as chief this year, and then Jeff and Christian last year. Dr. Edwards has been the point person from the Farber Hospitalist, and then Dr. Harrop from our neurosurgery service. So, the care of our spine patients at Gibbon often involves a multidisciplinary team, which includes neurosurgery residents, the Farber Hospitalists, the nursing staff, as well as physical and occupational therapists. And more so than our patients at JHN, oftentimes post-op spine patients are on a non-neurosurgical service. So this might be someone that, we are consulted from the MICU or the SICU, a medicine service, or someone that we operate on that's officially in the hospitalist service. And, we operate on them, and we don't, I think, always do a good job of communicating what we did and kind of what the post-operative care treatment is involved for these patients. And so, if we operate on someone, we may do these procedures that, seem routine to us, but the hospitalist may not know, a medicine service may not know, what a spinal fusion involves, what the post-operative care involves. And so I think being able to communicate these findings with them is extremely important. So, kind of going through the way we treat these patients, you have to ask yourself, are patients receiving the best care that they can from their multidisciplinary team? Are we making sure that all the different treatment teams feel invested in patients' cares? And can we improve communication between the different treatment teams, not just to cut down on errors, but just so that patients can have a more seamless and enjoyable post-operative course? And so what I did last year was I made a 10-question survey online and submitted it to all the Farber Hospitalists, all the neurocritical care attendings in the ICU, as well as to the NICU nurses and nurses that work in the I-spine unit. After we got the results from the survey, I worked with a couple of the residents to create a post-operative note template that could be used on Epic. And then this year, we actually did a pilot study during the month of January, where we had residents use the note. We notified the nursing staff, as well as the physical therapists, occupational therapists, and the hospitalists that we were doing this. And at the end of it, we kind of held a debrief with the different treatment teams, especially the neurosurgery residents, and kind of thought about what their thoughts were going forward. So I'll just share. There's a 10-question survey. I'll share the results of a couple of the questions. So we had a total of 66 responders. And one of the questions was, how satisfied are you with the sign out that you received on post-op patients? And so you can see that, the majority of patients were either neither satisfied nor dissatisfied, or they were dissatisfied with the sign out that they receive on post-op patients. Another question that we asked was, how often do you read the post-op progress note that we write for patients? And encouragingly, we found is that the vast majority of people either always or usually read the post-op notes. And so kind of to gauge the interest on the utility of documenting a standardized post-operative note, we asked folks whether they thought that this would be helpful. And I think, overwhelmingly, people seem to think that this would be a very valuable approach to post-op patients' care. So after this survey was done, we met up a few of the junior residents and then worked with the chief residents, as well as the charge nurses for the Gibbon ICU, as well as the I-spine unit. And essentially we came up with this note template. So all of the generic information, such as patient name and age and male, female, those are auto-populated on Epic. This is a dot phrase. And all the areas with the 3 asterisks are essentially items that you can click through using F2 and it forces the person who's filling this out to kind of put a little bit of thought into it and actually quickly type out what they mean to write, as opposed to just clicking stuff from a generic drop-down menu. You'll notice that, in addition to, I think we're always kind of focused on the post-op exam, just to make sure we didn't give someone a deficit, which is, certainly important. But there's a whole bunch of other stuff that goes into patients' post-operative course that, again, we may take for granted, but other folks may not know. So, for example, imaging. Sometimes we get, imaging in the OR that suffices, whereas other times they need to be done post-op. The difference between doing a fusion and a laminectomy, we know that, a fusion would need a brace. But again, physical therapy is constantly asking us, whether the person needs a brace to come out, activity restrictions, that kind of stuff. And then oftentimes, patients may be sick, they might have medical comorbidities. And so we're often consulting JATs, medicine, for glucose control. And so it's important to kind of, where we have a section to write down what the pertinent medical issues are post-operatively that we all need to be cognizant of. And so we went through a couple of different iterations of the this post-op note template. We shared it with all the junior residents that were at Gibbon for the month of January. And essentially we said, we're really pushing it to make sure that we give this a fair trial. And this is the results of our pilot study. So these are all the cases that were done, all the spine cases that were done at Gibbon the month of January 2020. And for the entire month, I tracked the compliance that a patient had a post-op note in the chart the same day that they had surgery. So amongst all of our patients, 68% of patients received a post-op note that was documented in the chart. And then out of the 4 attendings, spine attendings that operated Gibbon, there's a fairly similar overall rate of compliance, which is interesting. One of the things that I didn't do, which was brought up after, is, ideally we would want the resident that operated on the patient to write the post-op note. I don't think it's necessarily the responsibility of the intern running the floor to post-op check every single patient, and he or she be the person responsible for writing the notes. So I'd be curious to see, if I went back, how many of these notes were written by the operative resident versus the junior resident. And so after the month of January, we all kind of sat down. We had 6 junior residents at Gibbon and went through it. And we, just had a very frank and honest discussion about how easy was this to use, whether they actually thought this was useful, whether it was, a good use of their time. And ultimately, the question is for this upcoming year, would you recommend continuing this? And most folks said that there was utility in continuing it. I think with the caveat from our discussion that, ideally this would be the operative resident that's responsible for filling this out, as opposed to, burdening the junior most resident running the floor even more. And so, kind of where I am with this project is, I think we've created a solid note template. It's easy to use, it's accessible. We did a pilot study where residents were able to easily use it and have favorable attitudes towards its implementation going forward. And in the future, it's really important that we continue to, I think, create this as part of our culture. I remember before, we had Epic, we were running around finding people's charts and handwriting, post-op notes. And I think we've kind of gotten away from that a little bit for some reason. And I think it's important that we bring that back. And then what I want to do is also send out another survey after, we do this for 3, 4, 5 months, and ask the nursing staff, ask the hospitalists whether they think this is helpful on their end, and kind of see what their thoughts are. And then one of the recommendations that I got was actually that, residents have to fill out a brief op note when they're done with the end of the case in the operating room. And, maybe this is something that can be incorporated into that workflow, because currently the brief op note is, pretty useless. It doesn't have really any information, but I think it's an ACGME requirement. And so I think if we make that more useful, it's just kind of an automatic portion of what we do. And ultimately, I think we want to create a culture of inclusiveness where, again, we're fortunate enough to be able to, do what we love, enjoy on operating on people, but we do have a responsibility to make sure that their post-operative care is dealt with properly. And ideally, like I said, in my view, this is something that the operative resident should be responsible for, not necessarily the intern or the junior resident running the floor. If anyone has any questions, I'm happy to take it.